Dr. Loh, maybe I'd like you to comment on a couple of things. I think one of the questions that I have, because this topic is rooted in the theme or the concept of port cities. So how would Singapore, in the way it deals with chronic diseases, fit into the model, the mold of how other colonial port cities suffered from infectious diseases, as well as how the colonial authorities dealt with it? Would there be a difference in terms of this?
Actually, I'm still studying this. There was an attempt, by the League of Nations that was set up after the First World War to create a health commission in Singapore, based in Singapore, which would carry out a regional kind of surveillance and study of the spread of diseases across these ports, Singapore, and other ports in the Far East. So I don't know how successful it was. I would think probably it was not very successful, as the League of Nations itself was not very successful in general. But certainly many of these diseases spread from other ports. They came from other ports. So, because the big outbreak of the early 20th century is the 1918-1919 influenza outbreak after the First World War, so-called Spanish flu, and that came from somewhere else. Absolutely. I mean, it came a long way to Singapore, and it overran Singapore's hospitals. And other diseases, the two that were most concerned to the British were smallpox and plague, and also cholera. And of course, we always know about plague as something brought by the ships, by the rats on the ships. But there was a lot of study, in the 20th century about where the plague came from. Was it from the rats or was it in Singapore, right? Among the rats in Singapore. So, so sometimes some of these diseases become endemic. They become impossible to remove from the society, and they continue to circulate year after year. So I would say the British had a difficult time trying to screen out these diseases. The three big diseases, as I said earlier, were plague, smallpox, and cholera. It was not tuberculosis. And if someone is deeply sick of these diseases, you can kind of tell from a visual inspection. So the immigrants that come to Singapore would be screened at St. John's Island, where there was a quarantine station. But this quarantine station would, I would think it would not be totally effective. And many of the people who actually are sick, but maybe do not reveal the symptoms very clearly, would come into Singapore, and then, they go to the shop houses, or they'll go to the coolie lines, and then you can have the disease spreading there. So in terms of there's definitely a transnational element in the development of outbreaks in Singapore. But it's also local factors, in a port city. Port cities have their own characteristics. There is a British quarter, a colonial quarter, and then there is the Asian quarter. And these are almost two separate worlds. Very often, like I've seen for cholera or typhoid, someone dies or is dying. What do the neighbors do, right? The neighbors sometimes, or the landlords, they would just call a rickshaw puller and move the person to near the hospital, drop the body there, and then run away. And there have been landlords like this who have been fined, for not cooperating, for not informing, because the three big diseases were then notifiable diseases. That means that if you knew about the disease, you had to inform the government, because these are infectious diseases that can spread very quickly. But there was not a lot of cooperation among the people in Singapore. So, if we look at what is happening in COVID, And I think the situation is much better today, but there's still some tendency to avoid the government, to ignore the government. And this is part of our history of being, in a way, ruled by the British. You have a colonial government that's ruling over an Asian population, and the two have got very poor relations for a long period of time. The other thing was, sometimes someone is sick in a shop house, and then the British got to know about it and they want to find out more, and the person would move house, run away until they cannot be detected anymore. So they would move to another part of the town where they could continue to spread the disease. So this was the nature of port cities in a sense. So port cities are a wide category, but within the port cities, you have got certain social histories which reflect the kind of relations between the Asians and the colonial government.
Give students tasks. Sometimes it's a historical empathy task on a perspective task. So if I were a new migrant in the 1860s or 1870s coming in, and I wanted to work in Singapore or transit through Singapore, what would that quarantine process be like in terms of like stopping at St. John's Island and things like
that? I'm still hoping to find out. I'll find out more with my current project. So I think they are given a physical inspection, and there's a doctor there who would look through the men and women, if there were women among them, and screen out those. So those who are very, very clearly sick would not be able to land. And the others, the majority will be allowed in, because the economic imperative is strong, right? We needed those immigrants to come in to provide the labor for the entrepot trade. And many of the immigrants are not actually disembarking in Singapore. They are en route to Malaya or, other parts of Southeast Asia where, the Chinese or Indians are going to work. So the quarantine was very important. And it was a one moment thing. Once you pass the quarantine, it's like the airport, right?
that?
Once you pass through, you go through. And what is required is then within Singapore Island itself, how are you going to continue to inspect and keep track of the immigrants who then move into the city and live there? What happens when they are sick? So this was a big problem because the British colonial government had very little control over the shop houses. They could go in once in a while and order the sick people out, or they could break down the cubicles so that people are not so crowded together. But once they leave, it's very much back to normal again. So it's also dealing not so much with disease itself, but also with the whole economic and urban transformation of that area. Right? So eventually the decision was made to move the population out to new towns outside of the town area. So that's why, unfortunately today, no one is living in the shop houses anymore, and we are all living far away. So the medical history of tuberculosis is very much connected with the history of housing and the way that urbanization has changed us in Singapore, the way that we look upon. So I think the first and last chapter of the textbook is absolutely tied together.
Can I ask a question?
Yes, we are.
Hello?
Hello.
Yeah. So from the perspective of these migrants, right, how much do they know of these diseases? Or was it just something that they didn't know of, or like, when they see their peers dying, do they know that there is like tuberculosis, smallpox, malaria, so on and so forth? So how much awareness did they have of these diseases back then?
I think you mean how much awareness as modern diseases, the way that, they'll be understood by the doctors. They always have their own, the Singapore population always had their own understandings of what these diseases were. Even if they use the same name, they thought of the causes and the treatments quite differently. A lot of it is based from their own community medicine. So there's a long tradition, for example, of Chinese medicine. So the treatment of tuberculosis would therefore stem from the herbal treatments, and similarly with Indians and Malays, they had their own traditions as well. Sometimes it's not even kind of herbal or medical treatment. Sometimes it's, they have their kind of the bomos, for example. The Malays have their bomos, and the Chinese have their, and the Indians have their priests, to come in. So they see it also as spirits, caused by spirits, and therefore you need to remove the bad spirits from the person.
Okay, thank you.
Okay, thanks, Dr. Loh. Are there any questions?
Hi, I'd like to ask a question. Hello. How was it like? Was it documented with other races as well in your research? And what were the numbers like with other races?
For what? Tuberculosis?
TB, yeah, TB.
Let me look at the slide. Well, I mean, the numbers are quite damning, Right. So over 1,000 Chinese deaths compared to, the other races didn't reach 100. So by this time, about 3/4, the proportion never changed very much. The proportion as it is today, the proportion of the Chinese is still about 3/4. So this is more than 3/4 of the deaths. How do we then see whether TB is really a Chinese disease or not? It's also a factor of where they live in. It's the Chinese who are living in the shop houses. Often, the Indians many of the Indian working class worked for the British, so they are given quarters, coolie lines or British quarters to live in, where conditions should be better. Malays don't live in the shop houses mostly. They might live in villages or kampongs, which in this period, beginning of 20th century, would not be very crowded. They would be more spread out, more sparsely populated. So the numbers are very overrepresented among the Chinese because of the environmental and economic factors. That's how I read it.
Thank
I have
you.
a question. I'm just wondering whether or not there was any stigma associated with the people visiting doctors, given that maybe if I were to see a doctor, it will confirm that I have a certain condition, and then it may impact whether or not I'm able to go to work. So whether the people prefer to use traditional methods as compared to being confirmed with this official disease.
Yeah, definitely there was a fear. For a long time, maybe until after the Second World War, most of the Asian population, especially those who are not Western educated, would be fearful of going to a hospital. I mean, not even to mention speaking to a Western doctor, how incredible that would be, for a coolie from China to speak to a colonial doctor. So it leads to a vicious cycle where only the people who were abandoned or the people who were found dying on the streets or very sick until they could no longer live on their own would go to the hospital, and then they die there. And then this creates the phobia of going to the hospital because it's a place where you die, where not a place where you are going to recover. Among the Malays, for example, you have, because the Malays are a settled community, unlike the Chinese and Indians. So if someone was sick, they take care of them within the kampong using either, traditional herbs and healing, or they call the BOMO to come and treat the sick person. Having said that, I would say also the people of Singapore are incredibly pragmatic. So once they realized that the hospital the British had jazzed it up a little bit, upgraded it, modernized it so that, it didn't look so bad and not so overcrowded, people increasingly understood what a hospital was. And if the antibiotics worked, people would understand, this is something that can help me. And then they would, increasingly embrace the antibiotics, the vaccination and all that. So, to me, what is happening today with the vaccination of, COVID-19, that's incredibly interesting. It'd be useful to look at what the outcome is going to be in terms of the numbers, how many people are going to take the vaccine, and which vaccines, whether there are still concerns, because this vaccine is relatively new compared to the vaccines that we've had. Interestingly, there was a proposal to make the vaccination for TB compulsory in 1961 or 62. But our government rejected the idea. It's like, it will be voluntary. You just need to get permission. If you are a baby or a child, get permission from the parents. So it's still voluntary. Some of our vaccinations are compulsory, of course. So what has happened with the attitude and the perspective of people in Singapore regarding Western medicine is a very pluralistic form of thinking. Singaporeans are so pragmatic that they can use different kinds of medicine. So even today, we go to the doctor, when we are sick for the medicine, but we continue to have other kinds of, traditional treatments on the side as well. So that kind of pragmatism was something that existed from the beginning of our history.
You were mentioning that there's this perception that TB is a Chinese disease. And I know that we're saying that we should not racialize diseases, but I'm just wondering about the sources that you were using for your book. How representative are the sources of the other races and the perspective of how other races dealt with TB? Or are your sources more based on English and medical records from the British?
Yeah, you're right. It was, I tried very hard, to find people to interview, who give like their own perspective. Actually, I did manage to interview a young Malay lady who had TB. So she's young, she was treated for TB in her undergraduate years. And she gave me a very good interview, but it was just one interview, and I could not say, it's representative of the Malay population, but very useful, that all the interviews I did told me how much stigma had remained today about tuberculosis. Like if we knew someone had tuberculosis, would be, immediately, wow, God, I'm afraid of you. I want to stay away from you. Even though the treatments that we have today are very, very effective against the infection. There is a way to read the official documents against the grain. Any official document, even if it's a government document representing the work of the government, the Ministry of Health, there are always fragments that show the people's experiences. So with other diseases, for example, you could have diseases that are more like, for the other ethnic groups. Yeah, so you can find those things that you can pick them up there. You can also pick these sorts of sources, these sorts of perspectives and evidence from like newspapers. If you are therefore looking at non-Chinese, we can look at non-Chinese newspapers, oral history interviews. Sometimes if you can do oral history interviews of these diseases that they could be very helpful. I've done interviews with leprosy patients, extremely useful. I would not have been able to do my work on leprosy without those interviews. For TB, as I said, it was very hard. And the difference between TB and leprosy, leprosy is a disease that caused a lot of fear, and the people who had leprosy in the past were mostly rejected by their families and by their society. But I was able to interview them. Why? Because they were living together. Because they were rejected, you see. So they were living in this leprosy home. And I went down every week to interview them. So some of them declined, but some of them agreed to be interviewed. Whereas leprosy, you don't have a home like this. Everyone is living their own place, and many people were not willing to be interviewed. So that's one of the difficulties I had. So I would say oral history. I love to do oral history, and it's a really good source, to gain other perspectives.
Dr. Loh, you're an expert in infectious diseases. You wrote stuff about leprosy, also about tuberculosis. What about the Spanish influenza and the Spanish flu? Would you like to say something in the other about it before we call it a day?
Well, we were not prepared for it. We had an infectious disease hospital at the time called Middleton Hospital. This was a new hospital at the time. It was set up in 1913, and the flu broke out in 1918, 5 years later. But the hospital was not enough. It was overrun with patients. And in general, the British in Malaya, Singapore were not prepared to deal with it. You had got large numbers of people dying, especially the Indian plantation workers. So the interesting thing about the Spanish flu is that it, unlike tuberculosis, it didn't hurt the weak so much. It hurt the people who were strong, who were healthy, because the body overreacts, like, with COVID-19 sometimes. And so this causes the death, actually, the body's own immune system overreacting and causing. So, the person dies in a very terrible way because of this self-reaction. And, many of the Indian plantation workers who were, like our migrant workers today, very healthy, young, died of the flu. The British government, I wouldn't say had a badge of glory in handling the flu. It was a lot of the NGOs, the community organizations that stepped forward to provide a lot of the relief and support for the patients. That's all I can say now.
Okay, thanks a lot.